Good afternoon, everyone. I'm Ken McLeod in the WBZ studios. You're looking at the governor, obviously, from the State House. He is preparing to give us a briefing on the critical phase 2 of the reopening plan. Particularly, will it start on Monday or will it be delayed?
So good afternoon. We're here today to provide an update on phase 2. Secretary Sutters, her team, and the Medical Advisory Board have been reviewing the public health data this week. The critical pieces of data that we monitor, like hospitalizations, positive tests, and other measures, are all moving in the right direction, which means phase 2 will begin on Monday, June 8th. This terrible virus and the terrible toll that it takes will be with us until there are medical breakthroughs with respect to treatments or vaccines. But thanks to your hard work and your sacrifices, we're bringing the fight to the virus, and we're moving forward, and Massachusetts is continuing to reopen. With the help of the Reopening Advisory Board, which is led by Lieutenant Governor Polito and Economic Development Secretary Keneally, we've mapped out a gradual, phased-in plan to reopen our economy based on the public health data with measures in place to keep fighting the virus. In a world where COVID-19 exists, everything looks a little different. We're asking people to follow new safety protocols, to rethink the way they interact with customers, to stagger work schedules, and to work remotely. And so far, we're enormously grateful for everyone's support and creativity in adjusting their operations. This is on top of our request for people to keep their distance, wear face coverings, and do without several forms of gatherings and socializing since the middle of March. We've asked a lot of everybody here in the Commonwealth, every family, every business, every employer, every government agency, every individual to get to this point. But so far, we've made tremendous progress. We've been successful in bending the curve on COVID-19, and the metrics reflect that progress. Last month, we posted a dashboard that had key indicators on it, and yesterday, the COVID Command Center upgraded a third metric, the number of COVID-positive patients in Massachusetts hospitals, to green. Since the beginning of May, the 7-day average for positive COVID-19 tests is down 82%. The 3-day average of patients hospitalized is down 55%, and the number of hospitals operating in surge is down 76%. It's good to see these stats continue to drop, but we're also happy to see other stats moving in a different direction. We've conducted a total of 630,000 viral tests for COVID-19. We continue to increase the number of tests conducted per day and the number of testing stations available across the Commonwealth. And with our federal testing plan, we plan to significantly build on our testing and tracing infrastructure as we prepare to battle COVID in the months ahead. The start of phase 2 is a bright spot for our Commonwealth. It marks progress and will hopefully breathe new life into our economy for more sectors like retail, restaurants, and lodging. We know the closures have been extraordinarily difficult. And as governor, these are in some respects some of the most challenging decisions I could ever imagine having to make. But thanks to the cooperation of so many, the trends have been moving in the right direction, and we're now able to reopen many of these businesses. You'll hear more about phase 2 in a few minutes from the Lieutenant Governor and others. We're also expanding the list of outdoor recreation opportunities so that families can enjoy time outside at pools, playgrounds, and spray decks. As online learning winds down for K through 12, I'm both relieved and happy that our efforts to fight COVID-19 have resulted in this particular milestone today. Parents have been putting up with a lot for the past several months, and I hope phase 2 will offer some different kinds of outlets for kids. Another important part of phase 2 is the return of preventive health care services. For months, our healthcare providers, our hospitals, and doctors have pushed off annual exams and procedures like mammograms, colonoscopies, and heart screenings due to COVID-19. These important medical procedures are green-lighted in phase 2. Our healthcare providers have done an incredible job of managing us through COVID-19. And they can safely and effectively manage other healthcare needs And we urge our medical providers to reach out to your patients, particularly those with pre-existing conditions or vulnerable circumstances, and schedule those appointments soon. We are clearly on the path to beat the virus, but as I said earlier, until there are medical breakthroughs, we have to continue to take the fight and play our part in fighting the virus. COVID-19 is still very much with us, and it's incredibly contagious and in some cases merciless to those that are affected by it. And while we should all feel a certain sense of relief and progress with respect to the start of phase 2, we should also keep in mind that we have a way to go to get to what we would call a permanent new normal. Government, employers, and individuals, we all have jobs to do, and executing on these is the only way to continue to move forward. I know I've said this probably well north of a few hundred times since the middle of March, but please do your part to continue to socially distance, wear face coverings, practice good hygiene, stay home if you feel sick, because that all helps us keep moving Massachusetts in the right direction. At this point, I want to turn it over to Lieutenant Governor Cecilia.